Delighted to show you around our simulation centre today, which is on the top 3 floors of this 10-storey building. So here we are on the 3rd floor, and I'm going to show you now some of our outpatient rooms. So if you just follow me this way. This is actually an award-winning building. It was called Ireland's favourite building. It won an architecture award last year. So we're lucky to be housed in this gorgeous place. I'm going to bring you in here now to our outpatient clinic room setting. So you'll see some of these rooms in just a moment, but as you see as we're walking up this corridor, we have 10 different rooms here. And students have the opportunity to come in, to meet with patients, to meet with actors, to work with each other as well, and do things like conflict management, communication skills, breaking bad news, or history taking. So I'll just show you here, this is our control room, so our central area, where we have a dedicated team of specialist technicians that work with us. You might meet some of them later. And they manage Learning Space, which is our learning management system. So this is CAE Learning Space, our learning management system, and this is our control area. So as you can see here, faculty or other team members, other students can observe the students in the room and how they interact with the patients whilst they're in there, depending on what activity they're doing. But we can go in and take a closer look. So, as you can see, this is one of our outpatient rooms. So we have lots of things in here to make it feel like a realistic clinical setting. And these rooms are used by all of our students. So we have surgical trainees coming in here. We have our medical students, physio, pharmacy, and they come in and use the space to interact with one another, to role play, to interact with patients. And it's great that they have that opportunity to feel what it's like in a safe learning environment. And that's a really important aspect of simulation, that safe learning environment for the students. And an opportunity then for their fellow students to observe, their faculty members to observe and to give them feedback. And also to provide an opportunity for self-reflection, so to look back on their videos and their performance. So it's great that they have these rooms and spaces to do that and pretend that they're in a clinical setting. So we'll go on now and have a look at some other spaces in the building. So here we have our patient lounge space. So patients are at the heart of everything that we do here at RCSI, and patient-centred care is so important to us. And that is why simulation focuses around this, around the patient at the centre and ensuring safe, best practice care for them. So we're so lucky to have a wonderful group of simulated patients that come in here and work with us. We have simulated patients who are volunteers, we have actors, we have real patients that come in. We have surface models, paediatric, older professionals, a whole mixture of people who come in and work with us. And it's really important because this gives our students the opportunity to have realistic interactions with patients. So as they are so important to us, this is their dedicated space in the building, the patient lounge. It's great that students have the opportunity to meet with real patients, and they also have the opportunity to get feedback from them. So to know what it feels like to do that, whether it's a GP consultation or history taking from a patient in a pharmacy setting, they have that opportunity to interact and get feedback. So now we're going to go upstairs and take a look at some of our inpatient rooms. Hi. So this is our task training room. I say everywhere is important. I was going to say another really important space, but it is. Because this is where our students can come in to learn skills in this safe environment before they go out to patients for the first time. We set up over 100 different types of clinical skills here in this room. Things like inserting a catheter, how to take blood, how to check blood pressure. And this means that the team of technicians are real experts and know the difference between a 21, 23, 25 gauge needle. They know what kind of scalpel you might need to use for a chest drain, and they know where to order and get all of this equipment, just as you would see in the hospital environment or a clinical GP setting. So it's a real opportunity again for students to get familiar with what they would do and the equipment that they would use. You'll notice in this room there are no projectors. Medicine and health sciences are a hands-on discipline, and it's really important that students can come in, practice together in small groups under expert supervision from our nurse-led faculty and our clinical practitioners that come in and work with us. So we're going to continue on and take a look at our inpatient rooms, where once the students come in here and learn, they can actually go and put them into action then with our clinical mannequins. You'll see as we walk throughout the building actually these signs. So many of our alumni have actually sponsored and supported the college with different donations. So that's noted around the building on these rooms. So we're going to head down this way. These are the famous stairs you may have heard about, modelled on an alpha helix structure. Okay, so now we're going to go on into the control room, which is where the behind the scenes magic happens in our simulation centre. So this is our control room space, and this is where our technicians would sit here with our control room panel essentially, and work with faculty to dictate what might be happening to a patient in a scenario. So you can see in here, we're going to go in there in just a moment, our mock operating theatre. And in there we have a patient, so we have SimMan, and we could have a scenario where the patient has come in after a car accident, where they're having respiratory arrest, an asthma attack, lots of different scenarios where students and trainees can come in and practice and learn. And on this side of the mirrored wall, the faculty and technicians can monitor the patient and can make changes to the heart rate, the oxygen saturations, the pulse, and all of those different signs and symptoms of the patient. What they can also do is speak to the trainees, so to try and keep it as realistic as possible. When the teams in there ask the patient questions, they'll get a response. So this is where all of that behind the scenes magic happens. It gives an opportunity for, again, trainees, surgeons, anaesthetists, we have different groups working together, and our students to come in and learn in this safe environment. So we're going to go on through and take a look inside. So we're coming in here now to our mock operating theatre. So this is actually a flexible space. So we call it our mock OR, but it can also be used as an emergency medicine room. So different spaces, but everything that you see in here is just as you would see in a real hospital environment. So we have the real beds, the monitors, we have a crash trolley here behind me, we have our medication trolley over there. So everything that you would see in normal practice. Here we have our patient. So this is SimMan, one of our advanced mannequins. So you can see him blinking there. His eyes react to light. He breathes. You can see his chest rising maybe a little bit there. You can check his pulses. And also the team are excellent at doing moulage. So we can apply bruising, we can apply scarring and lots of different things to give clues essentially for what might have happened to the patient or what the scenario involves. So when the students come in, they can practice their clinical skills, assess the patient, but we also do things like non-technical skills or human factors elements. So team communication, how they interact and communicate with the patient, maybe breaking bad news. So in some of our other rooms, breaking bad news to relatives or family. The concept of consent. We've had patients who only speak Spanish, and the team need to work around how they do that. And then on the other side of this mirrored wall here, we have an observation room. So peers and faculty can observe the scenario as it's happening and can give feedback, and they can get kind of a 360 feedback, so from their peers, from their faculty, and to share how the experience felt for themselves. So again, it's all very patient focused, which is really important to us, and that element of learning in a safe environment. So as you can imagine, SimMan is a very busy mannequin doing lots of different scenarios where students can practice their clinical skills, do their teamwork and communication skills elements, and lots of different human factors pieces that they can do in here in this safe environment. So we're going to go now and meet some of our other mannequins, and see our inpatient rooms, which again is where trainees and students can go in and pretend that they're in their real clinical scenario. So as we go down this corridor, there are 8. I'll actually just mention this as we're passing. This is our wardrobe department. So as you can see here, we have lots of different, you can imagine what type of scenario you might see. So this is actually clothing from one of our stab victims, where the students in this scenario, actually, the patient is a Jehovah's Witness. So there's some discussion around consent, and the patient goes unconscious quite quickly, and how to manage that in terms of blood transfusion. We have some workwear clothing. We have an electrician who comes in and has been thrown back, so it's quite important that a full assessment is done. They find the bruising on his back or her back, things like that. And then we have surgical gowns and lots of different things for different scenarios, so that our mannequins feel like real people where real things have happened. So we're going to go down and meet another one of our mannequins, Lucina, quite famous actually. We have 2 of them. She also featured on The Late Late Show last year, so quite well known here in Ireland, and very well known to all of our students as well, because this is where students can come in. They're in actually every Monday in small groups and have the opportunity to do a real birth with Lucina. So this means that when they go out into clinical practice, they're familiar with things like how to speak to the patient, where to place their hands, the different types of equipment, and how to deliver the baby. So our baby here actually looks like an unusual neck, but has some traction mechanisms in there. So they can see on the screens here behind me the difference between, they often feel, oh, I'm pulling too hard, I'm going to hurt the baby. But actually what that feels like to the baby compared to how strong the contractions are. So that's a learning opportunity as well. We have different types of placenta, so one might be missing, a part of it might be missing. They get shown how to deliver the placenta, and we can also do more complicated things such as breech delivery or shoulder dystocia. So we have our undergraduate students that come in, but we're also working with the Royal College of Physicians, or CPI. They're going to be coming in to do their obs and gynae teaching here, and Dublin Fire Brigade come in here as well. So before they came in here for their simulation practice and learning, they might have to deliver a baby in an ambulance or at the side of the road for the first time, having never had the opportunity to practice. Whereas now the feedback is amazing that they have the opportunity to come in here and do it with Lucina. Speaking of feedback, there's been some research as well to say from the hospitals that the students come out with much more confidence in dealing with birth and with these patients. Lucina, like Simman and our other mannequins, can show lots of different signs of symptoms. Her eyes can react to light. She can show signs of hemorrhage or jaundice. And there are sensors on her body to see how the students or trainees interact with her. And she'll also give feedback. She'll respond just as a real patient would, of her normal size and weight, in terms of any administration of medications or things like that. And all of that can be tracked and monitored on the systems here behind me. So you can keep an eye and see how she's doing. Here we have our Super Tory neonatal mannequins. These are tetherless neonatal mannequins and our most advanced mannequin simulators. So these babies provide an opportunity for students to learn more about common and rare paediatric clinical scenarios. Tory is really advanced and show lots of different signs and symptoms to mirror clinical scenarios. Our Super Tory simulators are also used for emergency medicine training, and we do a course each year called our Boston Peds program, where we have Harvard medical faculty that come over and work with our paediatric expertise here in Ireland from Temple Street, Crumlin and other paediatric centres to do different paediatric scenarios, for example, difficult airway, and Super Tory is very popular during that event. So that's Lucina, and now we're going to go up to the 5th floor. Hi, welcome to the 5th floor of our simulation centre, home to our National Surgical and Clinical Skills Centre. So this is where all surgeons in Ireland come for hands-on practical training here in our wet lab and our surgical simulator suite that I'm going to bring in and show you in just a minute. We're sneaking in because we're actually running our surgical boot camp here at the moment. Normally an intensive 2-week training program for our new surgical trainees. A little bit different this year in COVID scenario, but we do still have people on site to do hands-on practical training with expert surgeons that we have here as faculty. Just here before we go into the wet lab, we also have our Boucher Hayes auditorium, an absolutely lovely auditorium. You can smell the leather when you walk in. 50-seater, and in honour of David Boucher Hayes, who many of you may be familiar with, a former fellow and professor of the college who passed away sadly recently. But it's lovely to have that space as well for our trainees and faculty and people to use throughout the building. So we'll go on in. So as we're walking through here, might just seem like some sinks, but it's actually been quite a valuable space. So this is our hand washing station. We have scrub station there. So this means that surgeons can actually come in and practice hand washing and hand hygiene technique, obviously very important. But it means that they can do that here in this safe open space, and when they go out then into the hospitals, there aren't any delays with getting to know that procedure. So very important here. And we're going to come in now to our wet lab. So we're just sneaking in the door here. So this is our wet lab facility. So as you can see behind me, it is set up for boot camp at the moment. They're just on a quick break out for a walk around Stephen's Green. And here surgeons have the opportunity to come in to learn from surgical experts, faculty that come from all over the world to do training with them. We have 4K cameras. So these cameras in the ceiling can be used for faculty to demonstrate how the best way to do surgical procedures such as knot tying or more complicated procedures as well. So they're doing that in here at the moment. We have our laparoscopic trainers, again giving the opportunity for surgeons to practice their hand-eye coordination and dexterity. Many of the procedures that the surgeons will be doing here, there aren't actually synthetic models available for them to learn or practice, and obviously we'd like them to be able to learn this safe environment before practicing on real people for the first time. So the team here, the simulation team, in collaboration with faculty, develop models from biological materials so that it feels as realistic as possible, and so that they can learn and practice on these models and be ready to go once they go out into practice into the hospital.